Charles Payne and Tracy Burns, along with Lee Gallagher, Laura Schwartz, and Rick Lazio from J.P. Morgan Chase. Good to have him back. Charles, Hillary revealing the plan on Monday says we need it for all days. Will it register?
You know, Neil, obviously we have a problem. Everyone acknowledges that, but I'm real concerned about the Democrats and their plans. I think they're going to overreach and bankrupt this country. Also, we have to also look at some of these universal health care plans and say, oh, well, Canada, England, Cuba, and look at the whole package. The whole package means probably making 25% less than you make right now, being taxed at 50% more than you're being taxed right now, and just having a lesser quality of health care. I don't think that's the solution.
All right, Alexis, she's trying to say if we had done what I wanted us to do back in 1993-94, we wouldn't be in this pickle. Is she revisiting the same deal? Will it have the same response?
She has absolutely no choice but to revisit it, because that is how people remember her. It is without a doubt probably the #1 issue that she has to deal with as far as getting elected. And look, like you mentioned, it's a problem. We have to deal with it. We're always, you know, talking, but we're not actually executing. As far as I'm concerned, put everybody in a room. Put the executives in a room. Put the American people in the room. Put the politicians in a room. You know, sit in, Congress, and let's have a debate, because it is one of the #1 issues in this country, and we're not coming up with solutions.
Well, Rick Lazio, you took on Hillary Clinton for the New York Senate seat. You lost that one, but of course you roughed her up in the debates. I had to remind people of that. But what do you think of that? That maybe the time and the appetite has come for some sort of health care, and Americans seem to be more predisposed to it than they were a dozen years ago.
I mean, it's a huge problem. It was a huge problem in 1993. It's still a huge problem. 45 million people uninsured, a lot of people that struggle. There's a lot of people who actually are covered by Medicaid that don't take advantage of it. So I personally am of an opinion here that let's give her some time to explain what her plan is. Let's give her more of an opportunity as some people gave George Bush when he outlined what I thought was a very credible health care plan that would eliminate some of the tax advantages that corporations own, not all of them, but some of them, decrease the incentive for people to overspend on health care and these Cadillac insurance policies, and try and provide a little bit more subsidy for lower income people who want to have choice. I think the problem with the government getting involved in health care and dominating the market is we want consumers to have choice. We want them to be empowered to be well informed and to make those decisions, and that one size fits all plans don't work well.
Well, here's my worry, Tracy. This is to address 15% in this country who don't have health care, right? So for 85%, it's not as huge an issue. So for the sake of the 15% who do not, do we just scrap it for the 85% who do? And do we address that, or we just throw everything into the bath? What?
Yeah, and I don't think we do. I think we have to get away from this whole notion of reform. You know, maybe we take baby steps with this thing. You know, to Charles's point, they're waiting online for heart surgery overseas. People are dying before they're even getting there. You know, universal health care is just access to a waiting list in many countries. That's all it's doing. And don't forget, just giving someone health care coverage is not going to make them healthier. Like, I think we need to come back to this whole notion of preventive care here at home, as opposed to trying to get everybody on this equal playing field, because there are so many people that actually are eligible for health care and don't even choose to have it. So the 85% coverage that we have now is really important to look at, and I think it's important to look at reforming what we have little by little, as opposed to this huge overhaul, because there's way too much going on, and too much money will be spent between Iraq and terrorism and all the things we have to deal with now. To do something like this, it'll never go through. We don't have the money to do this.
Lee, what do you think of that? We don't have the money. Now's not the time.
I disagree. I think we do need to think big and think big reform, because otherwise something's never going to get done. I mean, and Neil, to your point about the 85% and 15%, I mean, you know, for one thing, that 15% is really growing. So, you know, 5 years from now, 10 years from now, it's going to be more. And with those 85%, I mean, everyone else's costs go up as this problem gets worse. It really does affect everybody.
So you say we have to think big. Does that mean we have to accept a big price tag to do it?
Well, I think it's very interesting. I mean, Hillary, you know, she's working at a disadvantage here because she has a taint from what happened last time around. You know, I think there's this knee-jerk response against universal. The word universal. Universal health care means our taxes are going to go up. If you look at what Mitt Romney has done in Massachusetts, he basically, you know, the plan there was to take $1 billion that was spent on the uninsured, which, by the way, is not just just the people that live in poverty. It's working males in their 20s that are healthy and just don't want to pay
you
for
know
it.
this like an encyclopedia, but what he's trying to do with private incentives to get business to go ahead and insure their workers. But Laura Swartz, the thing that comes back to a lot of regular Americans is this big government stepping in a big way here.
And that's why Hillary has to be so careful about this reform package she's going to unveil on Monday. This has to be a partnership between the government, employers, and employees. Everyone sharing the brunt. It's interesting. There are 15% of Americans uninsured that this would help. It also would help those 85% other of Americans that can't afford it, can't afford accurate care or enough amount of care.
How do you know it will? How do you know that the cure won't be worse than the disease?
Well, because we've got to try something here, Neil. We absolutely have an overbearing problem in this country, and it can't be a socialistic approach. It has to be a universal approach. I come from a self-employed family. My parents growing up had to pay all their insurance, $800 to $1,000 a month, and that was a lot for a struggling
Well, here's my experience with a Republican president, and Charles, my experience with a Republican, this president, the Medicare prescription plan, started out originally being $250 billion. It moved up to $400 billion. At last count, it's costing $650 billion.
Right.
So good intentions have a price tag.
Absolutely, and you look at some of the things like the the S-chip situation and people with 4 times the poverty level being covered. We're talking maybe 60, 70 grand. After a while, someone's going to pay a big price. I don't see. I listen to Rick. I'm willing to listen to what Hillary has to say. But at the end of the day, I know it's going to somehow the insurers, the medical, the drug makers, they're going to be punished.
So if it costs more, all right, Alexis, if it costs more, can you pay for all of this by just hiking taxes on the rich?
Well, listen, I mean, that's going to be the $64,000 question here, is who bears the brunt of the cost?
Actually, a lot more than $64,000.
That's right. We're talking about billions of dollars, right? This is a $2.1 trillion system here. But the question here is healthcare costs are outpacing inflation. The number of uninsured is growing year by year, and more employers are not offering healthcare coverage. I don't care who you are, the American family at home is paying more for healthcare costs today than they have in decades, and that's a problem. If you're paying as much as you are today for a family, in some cases as much as $12,000, that's a lot of money. Where do we find that money? So is it incentives in the private sector, the Romney method, that will
No, what they're going to end up doing, they're going to hike taxes on Charles.
Neil, one point,
But you're also looking at putting
the look.
Well, listen, also I could
there are
perform
other
surgery
ways
on the
to pay
weekends.
for this than just hiking.
You know what? We're already paying
There are other ways than just hiking taxes. That may be part of it. Hillary's already talked about that, but it's talking about making electronic records, saving money where they're bilking a system now, because a lot of people without health insurance are bilking our taxpayer dollars because they go to the ER for the care. And
Well, you're assuming the government's going to be good at these records. Well, you have more faith than I do, but God bless you. We're going to